Cardiff woman Melanie James is the first person in Wales to have had the same experimental antibody treatment for COVID-19 as United States President Donald Trump. Miss James received the transfusion of monoclonal antibodies as part of the recovery clinical trial at the University Hospital Llandoch. The transfusion of monoclonal antibodies is the latest treatment which has been added to the randomised evaluation of COVID-19 therapy clinical trial, the largest randomised controlled clinical trial in the world. Despite Cardiff and Vale Health Board saying that this trial is in its very early stages, this arm of the trial is aiming to see how effective monoclonal antibodies are in preventing COVID-19 from entering the cells of infected patients. But how do antibodies actually work? Well, when it comes to coronavirus infecting one's body, antibodies attach to the spikes of the virus, blocking it from entering cells. But, of course, as humans produce various different types of antibodies, and it's determining which antibodies are best at attaching themselves to the spikes of COVID-19 is what scientists are trying to work out. After sieving through them to find the cream of the crop, as it were, scientists take the best ones and multiply them in a lab. These antibodies are then given immediately to patients, which in turn boost their immune response. Cardiff and Vale University Health Board became the first in the UK to take part in the clinical trial titled Recovery back in March and has recruited over 200 people. Back in June, the trial found that dexamethasone was the first drug proven to improve survival of coronavirus, and that was the steroid that's been used to help both President Trump and Miss James. Well, Miss James, we at Local TV wish you a very safe and strong recovery indeed, and hope that many will make a comeback as successful as yours in the battle against COVID-19.